Part 2, James Marica, Identity Crisis. Let's see if we can wrestle with the 4 identity statuses. There are 4 identity statuses. That's why I just said it. The first one is identity foreclosure. The adolescent's commitment to values generally reflects the parents. The adolescent has not experienced a crisis, has not had cause to fully examine his or her own beliefs and values and determine them for themselves. This is a bad thing. So their identity is foreclosed, stopped, until they determine for themselves their true identity. And this is identity related to beliefs, etc., etc. Their decisions generally reflect someone else's choices, and this results generally in low self-esteem. The second one, and this is a good thing, identity moratorium. Their crisis, their identity is currently in crisis. It's changing. They're not committed yet. They have suspended their definition. They're trying on a different roles, different values, different belief systems. They're wrestling with who they are. This is a good thing. That means you're growing and changing. Adolescents need to push against what was to determine what is or who they want to be. The third one, not a good thing, identity diffusion. The adolescent lacks commitment, has not yet experienced a crisis, lacks direction. No idea who they are and no attempt to find out who they are. There's no commitment to beliefs. They are uncentered. The adolescent does not want to commit, does not want to explore. This is not a healthy situation either. The fourth one is the most healthy, identity achievement. They have passed through the exploration and crisis stage and have made an exploration to who they want to be. But note, they've passed through exploration. They have done that. They have explored. They have tried out and come to a conclusion. So they have developed a well-defined set of personal values and a self-concept. And we don't lock into one and stay with it. We do this at successively higher levels all through our lives. But identity achievement is achieved only after you have pushed against, after you have explored, examined, rebelled, if you were. These adolescents, this stage is generally correlated with self-confidence, a sense of direction. You know what you are good at, what you are not good at, your passions. Here's a nice little overview. So, some consequences of these statuses. Identity achievement and moratorium are generally seen as healthy alternatives. Now, it's natural for adolescents, as I've said, to try on a number of identities and experiment with lifestyles. All right? The question is, think about yourself. What roles did you play or go through when you were 13 to 18 or even 20? Hopefully you are trying on a lot of different things. Now, identity diffusion is not a healthy thing. Here, adolescents go along with the crowd. They give up who they are. You are more apt to go along with the crowd in negative things. Identity foreclosure is not healthy. Number 5, be tolerant of fads and stages as long as they don't offend or interfere with learning. This is natural again. And the roles that adolescents do adopt are not permanent. We try on many different faces when we are in this stage. We try on many different stages, but to a lesser degree, all through our lives. We are not constant, stable entities, hopefully. If we are alive, we are growing. If we are more alive, we are growing, changing throughout our lives. So, when we look at sometimes confusion, disequilibrium, and depression, these are not always signs of sickness. Sometimes this is a consequence of wrestling with identity, wrestling with issues. There are events in life for which you should feel these things. So sometimes these are a sign of good mental health. You're going through a crisis or you are struggling with a life event of some sort. All right, hopefully this gave you a little bit of an overview and hopefully more understanding and appreciation for what adolescents are going through.